our project, first of all, I want to mention about an interdisciplinary project. It is the automatic assessment of gait impairments in stroke using artificial intelligence, wearable technology, and neuroimaging. In this project, together with biomedical engineering, the participants are the neurology Acıbadem University Hospital and radiology, together with the group from Wales, from computer science. So in this project, the stroke is kind of very fundamental problem in human life, and it is defined as an episode of neurological dysfunction caused by focal, cerebral, spinal, or retinal infarction. And it affects more than 13 million people each year globally. And 70% of all strokes are ischemic, meaning that it's a kind of blockage of the blood flow. It can be hemorrhagic as well, but most of it, we know that it's ischemic. In case of ischemia, there are some molecular events that are disrupted in the system. We know that the ATP deficiency will happen, as well as glutamate increase in the medium will occur, which since the mitochondria defect occurring, the ATP production is extremely low, and within a few seconds, the degeneration will take place. So this is a very basic mechanism and known in the molecular events. However, it's happening very often, especially in the elderly life. So depending on the location of infect, stroke may cause problems with gait, speech, or vision, and it is one of the leading causes of disability. Independent and safe gait is considered a primary goal in post-stroke care. So the aim is, in the project, is objective and automatic assessment of walking disability, associated walking disability to stroke-caused brain injuries, monitoring recovery of patients, and evaluate the efficacy of conventional rehabilitation programs, increase stroke awareness, and help design personalized stroke rehabilitation programs, and train health providers in this respect. So in this interdisciplinary project, there will be a delivery of a new wearable technology for stroke patients in Turkey. It is recently developed by the Aberystwyth University in collaboration with NHS Wales in UK. And this wearable technology provides high-resolution movement data to quantify walking disability and evaluate the efficacy of stroke treatment. And of course, this is not limited to stroke, to movement disabilities, but that can be extended to other diseases, just simply to Parkinson's or Alzheimer's patients in the future, and to just watch them from a distance. So you see the picture of the team together with a patient with the disability. And in this project, as I said before, since it's interdisciplinary, we are trying to identify some biomarkers, and I have to add that MR is also considered as a biomarker. Magnetic resonance imaging and gait analysis data from subacute stroke patients, meaning that the stroke is extended up to 2 weeks, because if it is very acute, that means the difficulty of movements is very adverse, and it's not good to just measure or to have the idea of the movement development and its progress. And that wearable technology system will contain a smartphone and a smartwatch, which we use in everyday life. So the information is also already collected from the phone and watch. The only thing is just to transfer that information to computers and to just to evaluate them from a distance. So the accuracy and effectiveness of the wearable technology will be tested, and in quantifying gait impairments against clinical observations. So how do they go parallel? Just it will be evaluated. To investigate the correlations between the in-fact lesion size and lesion location with blood biomarkers and gait impairments, and predict clinical outcomes using classical algorithms. Sorry, yeah. So there are, we know that from the literature that you can see here, the list of 15 of them. There are serum biomarkers. Most of them are not used in clinically. The very well-known one is the BDNF, the first one, brain-derived neurotrophic factor. And in this project, the first one that we will consider will be that one as well. None of them, as I said, considered clinically yet. There's a preliminary publication from the Welsh Stroke Conference, which is selected as one of the best articles among the 40 applications. That is from the 43 stroke patients, the ischemic stroke lesion segmentation challenge was made. And it successfully predicted the binary modified ranking scale scores, which ranges from the disability degree. It is for this case, since it's modified, it's between 0 and 5. It was just calculated as based on radiomic features using other boost classifier. And by the way, radiomics is the quantitative approach to medical imaging. So it enhances the outcome and understanding, of course. And the accuracy of this prediction was 82%, which is not, which is very good actually in that case.